This podcast is brought to you by Best Bonobos, the AI-powered platform that helps you sell your small business yourself.
Well, welcome to Business Owners Unfiltered, the podcast where we have an honest conversation with entrepreneurs about the real journey behind building a business. I'm Sebastian. I'm co-founder of Best Bonobos and tell a friend. And today I'm joined by Dr. Marcy, a physical therapist and business owner from Denver. You built your practice and that gives an opportunity to talk about the crossroads of healthcare and entrepreneurship, because that's a difficult one. Marcy, welcome to the podcast. Can you please introduce yourself?
Hi, thank you. My name is Dr. Marci Catallo Madruga, and I'm a licensed physical therapist and functional medicine provider in Denver, Colorado. And I run a small private practice where I see clients virtually and in person for both physical therapy and health coaching.
Well, we've talked before, and then we talked about how you got into the physical therapy field, and also about what made you start your own practice. Can you tell our guests more about why you started your own practice?
Yes, so the primary reason was because there was a change happening where I was working previously, where the expectation was that we would just see more and more clients per hour, as opposed to providing quality care. And on top of those things, there were also some business operational things that were happening that made it feel unethical to continue working in the environment that I was working in. And I just needed to branch out and do my own thing. Even in interviewing for other positions, the expectation was set that I would see 50 clients in a day, in an 8-hour day, and that just doesn't allow you to provide quality care at all. So it was something where I felt like I needed to make a move, and the best move that I could do was open my own business.
But how can you see 50 people in 8 hours? That's like 6 people an hour. Is that like 10 minutes?
Yeah, so the way that most clinics have it set up is that they hire a bunch of aides.
Yeah.
Some will hire also what's called the physical therapy assistant, and they'll have the physical therapist will do a check-in where they maybe spend 2 to 3 minutes with each client, and then they pass them off to an aide or an assistant. Part of that depends on what insurance they have. So if they have one of the government insurances, it has to be at least a physical therapist assistant. But if it's something like Blue Cross Blue Shield or one of those, they can pass them off to an aide and still charge as if the PT saw them, even though the PT only spent 2 minutes with them.
So you must have felt like a factory working on a conveyor belt.
It very much is like that.
Yeah, but and that way you can't ensure any quality of care anymore.
Yeah, the quality really goes down. And I think the other thing that happens is you end up with a lot of, especially new graduates, who got into a field because they wanted to help people, and now they can't really help because they're seeing so many people at one time that they're not able to give attention to detail. And one of the best examples that I could give of that, of how if I had had that many clients per hour and I hadn't been able to pay attention. A couple of years ago, I had a client who came into me post knee surgery, and her surgeon had wanted her to do PT at his clinic, but she said she was coming to me. She came in a couple of weeks post surgery, and her leg was completely cold, and she had bruising all over the opposite side of her body. And that was on a Tuesday. She came back on Thursday and was describing this thing that was happening in her body that just was not normal. And so I said, I need to talk to the surgeon. And she called him on the phone, and we were able to get him on the phone, talk to him, have a conversation, me give my opinion of what I thought was happening. And his response was then to meet her at the ER. Like if I hadn't had the time, if I had just spent 2 minutes with her,
2 minutes,
I couldn't have given her that level of care. And it turned out she would have died within probably a week if we hadn't moved quickly.
Wow.
because she was having a complete immune shutdown. Her
Hmm.
liver was failing, her kidneys were failing, and it was something that really needed attention. And she wouldn't have gotten that in a clinic where she was one of 6 to 8 people being seen at a time.
So that was one of the reasons for you to keep going with your own practice,
Yes,
because you could make a difference for sure.
exactly.
Yeah. One of the things is being an entrepreneur requires a completely other skill set than being
Yes.
a care physician. And how do you handle those two different worlds?
So at one point, I had grown my clinics where I had 3 physical therapists, a physical therapist assistant, and a massage therapist, and 2 admin staff. And it definitely came with its challenges because you're managing people and you're managing client care. Um, and one of the biggest things I did was I hired mentors. I hired people who were good at the business side and the business side
Hmm.
of healthcare, and asked them to teach me. And so I got the things in place that were important to have in place, understanding clinical predictive indicators for each person of how we could make the business more successful, and then how to motivate staff. Um, so it was definitely a different approach than
Hmm.
just patient care.
Yeah.
Um, but I had already been doing some management things in the previous position that I was in before I started my own company. I was managing all the supplies for 7 different offices, managing schedules for people, that kind of thing. And I had done some schedule management as well in a previous job, that wasn't physical therapy, uh, before as well. So I had had some of that experience, but it was a whole new level when you open your own business and have to go through, how do I run QuickBooks?
Yes, absolutely. And then, do you need a special license to open a health clinic?
No, in the state of Colorado, it's pretty easy. You literally file a piece of paperwork online.
Hmm.
Um, and as long as you are licensed to own that type of business in terms of your medical license,
Yeah.
you are good to go, basically.
So your medical license grants you access to
Yeah.
starting your own business as well. Yeah. And how do you work on quality control?
So currently it's different than before, because right now it's just me. Since COVID, I've been solo by myself. I let go of all my staff in 2019. Um, So right now I do a lot of surveying of my clients, which I did before as well, but before I did it with a suggestion box in the office.
Hmm.
So it was anonymous. Now I just ask them, how are we doing? Like, what can I do better for you? How can this go smoother? And I want their feedback, and they know that I want their feedback. And then I also look at how many referrals I'm still getting from physicians. So I send out letters to the physicians thanking them for referrals. I send out letters when I think somebody's not appropriate. And then I ask the physicians again for, how are your patients coming back to you and reporting about their care here?
Yeah. So you're not only an entrepreneur and a physical therapist, you're a sales manager as well.
Yes.
And then you do marketing and everything yourself.
Yes.
Yeah. The great thing about running a business is that you can decide to outsource things, what you did before as well, and getting outside help in coaching and setting up the business. How did you get to that idea of outsourcing?
Um, Part of it came from knowing your strengths and weaknesses, I guess.
Hmm.
Um, and knowing that entrepreneurship can be very isolating if you let it. And I didn't want to let it be that way. So I sought out people who were doing something similar, but on a grander scale.
Hmm.
And I asked them, how are you doing it different? How are you getting these people in your area? What would it look like in a mentorship? And one of the people that I had approached already had a mentorship in place. It was very small. Now it's gigantic. Um, and I just joined that group, and it was part of a Facebook group originally, I believe, and
Hmm.
then became a paid mentorship that I had meetings once a week to go through things with them.
Yeah, well, that made you start really good, I think, because that's one of the issues I hear a lot from other entrepreneurs, that it's lonely. They try to do everything themselves to save costs,
Yeah.
but by spending a little on coaching, that's what made you get the business off the ground.
Yeah.
Yeah, it's a good way to start a business, I think. Um, what are the things that you learned in that period that you were doing not quite right?
Well, in the first year, because I was still just growing, I wasn't keeping track of the numbers. So I wasn't keeping track of, how many new patients were coming in, how many of them were booking a follow-up appointment, how many of them were meeting their plan of care or discharging themselves early. And I started tracking that, and it became easier then to predict income for the company. So there was that. I outsourced the entire accounting because I was just like, I'm not good
Hmm.
at this. I don't enjoy it. I don't want to do it anymore. So I just outsourced all of it, and took that off my plate. And now I only check in every week. They send me a report. They would like to only send me a report once a month, but that's not good enough. I need it every week. Um, so those things were things that I started tracking. And then I started doing quarterly check-ins with each employee where I would have them fill out a survey where I asked them to look at, what are your goals? How can I support those goals? What do you need to do individually for those goals? And then how do we progress them forward? And it was interesting doing those things, because you learn a lot about people on a personal level because they would write
Hmm.
down what their personal goals were, but then also what the business goal was. Um, and it kind of made us all more connected, I feel like.
So instead of just an employee, they became assistants of your entrepreneurship as well.
Yes.
Wow, that's a different approach. I haven't heard that one before. Can you explain how you got to that idea, and how can you teach it to other entrepreneurs as well?
So I watched a YouTube video on the way that Lululemon grew their cult following.
Hmm.
Um, and I listened to what the leadership did, and they literally, Lululemon takes every single employee down to the person in the stockroom through a quarterly assessment of how they're doing based on how the employee feels like they're doing and how the company feels like they're doing. And then they write a plan together to kind of solve whatever the problem might be.
Hmm.
And I thought that that was a really great way to approach it because then it's not like an annual review where you may not have known something was going wrong all year and then all of a sudden
Which
it
is a
pops
long
up.
time. Yeah.
Yeah, it was something more consistent, and it made the employees at Lululemon feel like they were more invested in the company. And so I was thinking, well, that could apply to this too. If people are, if they know that I'm invested in them as a human, they would also be invested in the business.
Yeah. But I think this is part of your personality as well, because apart from being a physical therapist, you do more than that. You give lifestyle coaching and other coaching. And so you have an investment in people.
Yes. But I
So
don't
this
think that's that hard.
that's something you learned through time.
It, I don't know. I think some people are born with it.
Hmm.
I think you can teach it. I think people can learn it. Um, but I think some people are just born with that ability to connect.
For some people, it's easier to connect.
Yes.
absolutely. Yeah. Um, Looking at your practice, it's currently running on you personally, just you. It gives you a lot of freedom, but it must give you some anxiety as well.
It does, yes.
How do you balance those two?
Uh, I in the past year, I have set some pretty firm boundaries in place for myself. One of those boundaries is that my phone goes away at 6 p.m. And I don't, even though I don't open my computer past 6 p.m. It's a boundary that I've set and I'm just honoring that. I also have made sure that I put stuff on the calendar that's important to me. So my workout goes on the calendar. It's a
Mm-hmm.
meeting I don't miss. I don't, if anybody wants to schedule anything, I just say, I'm sorry, I'm busy.
Yeah.
Um, and so setting those boundaries, I think, has really helped me.
Yeah, I think that's a good tip to balance private and business life. Um, but doesn't it withhold you building a bigger practice? Or is that just the choice you made for now?
I think y- in some ways you decide how big do I want to be, right?
Mm-hmm.
I've run the $1 million practice.
Yes.
Um, and now I'm running a $200,000 practice. Um, and where am I happier? I would say it's now.
Because you're more balanced.
I'm more balanced. Whereas before, I started saying this when we got to about 3/4 of a million. I cannot operate efficiently in your emergency because to everyone else, it's I need this now even when they're your employee
Mm-hmm.
versus if you give me a heads up about what you need coming up, I can help you more. And so I think I very much before was less forgiving of what other people were doing because I was allowing them to get away with it versus now where I have boundaries set firmly in place and just say, I'm sorry, no.
Mm-hmm. And
So I
that's
don't
what,
know that it limits me. It helps me be where I want to be.
well, it limits you in one field and it opens a lot of doors in other fields.
Yes.
And that gives you back, once again, the balance. How do patients look at your boundaries? Because I know that a lot of patients think you're working 24/7.
Interestingly, I just onboarded a couple of people last month and they are struggling with those boundaries. And instead of apologizing, I told someone on Monday afternoon, I acknowledge that you don't agree with the fact that I have a life outside of you. That is not
Mm-hmm.
my issue. And that was how I put it. And we had a phone call set up for today, and she apologized to me on the phone today. So I think sometimes we think we should be doing something and that people have this expectation, but they only have that expectation if you allow it.
Yeah.
So by not allowing it, I just drew that line in the sand again and said, this is when I'm working. It's a full day. It's 8.5 hours. I don't need to be operating in your emergent situation.
No, you can just keep your schedule,
Yeah,
plan ahead, and know what your week is going to look like.
exactly.
Mm-hmm. Um, are there any things you're trying to figure out as an entrepreneur right now?
Marketing. I feel like it changes every 6 months.
Boy, I think it changes daily, to be honest.
Um, it feels like every time I get something figured out, the next thing is coming around and I have to change strategy all over again. So the
Mm-hmm.
marketing, that's the biggest thing.
I think you're absolutely right on that one. I noticed that marketing is changing constantly,
Yeah,
but also the whole environment of marketing is changing.
exactly.
The tools are changing, people are changing, demographics are changing. So it's a difficult field to be in, I think.
It is. And I know one
Um,
of the things for me personally with that is, like you said, that the tools are changing. A lot of people are using AI for ads, and I just scroll past those. I want a connection. Like
Mm-hmm.
since 2020, we've been so disconnected, and I think people want the honest, real thing, or at least that's how I feel.
Well,
And if you give me an AI video to click on something to watch a webinar and the webinar is all AI as well, I'm sorry, I'm not
you're
working with
not
you.
connecting, and then
Yeah.
no, you're not buying.
So, I mean, it's working for some people, but it's just not my cup of tea.
I understand. So you can be yourself and therefore stand out again.
Yeah.
I think that's one of the main learnings from the current marketing perspective is be authentic and
Yes.
create your own content.
Yes.
And that's why we are having this podcast as well, because we believe in honest conversations with people instead of running a AI podcast, because that would have been a lot easier. And you can produce a lot more
Content quickly.
content quickly. Yeah, yeah,
Yeah.
yeah. Apart from the marketing perspective, you are working in a field that's quite regulated with insurance and stuff like that. You decided not to work with the insurance companies.
Yes.
But is there a pressure from them to acknowledge their payments, their clients? How does that
No.
work?
So, one of the things that started happening early on in my career as a physical therapist is I got difficult clients. So I was referred the clients that had seen three or four other people and hadn't gotten better. And so I still get those clients. I get the clients who've, quote, failed physical therapy, and I'm asked to try and help them figure out what's going on and how to fix it. And I think part of the reason that my approach works so much differently and helps them actually achieve that is because of my background in nutrition and wellness. I'm able to see, oh, well, you have this entire inflammatory cascade happening. And yes, it's affecting your neck and your back and your hips.
But
And
that's a
of course, it's
symptom.
going to be all involved. And if we're just looking at one joint, we're missing the point. So I think, in a way, and a lot of the techniques I use are also not covered by insurance currently.
Mm-hmm.
So they don't want me in their system because I
No,
don't follow
you
the
don't
rules
fit their
anyway.
system. No. But how do you feel about the other side that some people cannot afford to go outside of their insurance?
Yeah, so the average copay in the United States right now is $50 a session for physical therapy. So when somebody says, I can't afford to see you, if they're going to physical therapy 2 to 3 times a week, they're spending $100 to $150. One session with me is $200. So, and I typically only need one session a week. And sometimes, for a lot of people, it's one session every 2 to 3 weeks. So they actually save money when they come to see me.
In the long run, they're saving money, and then
Yeah.
they're looking not only at the symptom but at the whole holistic problem.
Yeah.
Yeah. Well, I think we have to conclude what we are
Okay.
talking about. It's really interesting to see how you built your practice, decided to go back to being a personal practice again. That's quite a journey you've taken as an entrepreneur. Is there any tip you want to give to newcomers in healthcare to want to start their own practice?
I would say the biggest thing, especially legal regulatory compliance wise, is understand what your individual state or country or area requires of you and what then qualifies as being within your scope and out of your scope. And actually have, because I didn't do this originally, I had to go back and do it later and it was well more expensive. Actually have the business set up so that you can grow it in multiple directions if you want to add services down the road. And get that help from the lawyer originally. And then, of course, somebody else has done it before you, find a good mentor.
That's a good tip, but that helped you great as well.
Yeah.
Yeah. Well, thank you very much for sharing your journey with us and with other entrepreneurs. If anyone is in the Denver area, how can they reach out to you?
The easiest way is probably my website, which is drmarcycm.com.
We will include that in the comments as well, so people can find you. You also do online healthcare and stuff like that?
Yes. And that, again, easiest way to find me through that website. All those
Through the website.
Come to me. All those emails come right to me. So,
well, thank you again. And
thank you.
Enjoy your day.
Thanks.
This podcast is brought to you by Best Bonobos, the AI-powered platform that helps you sell your small business yourself.